In order to understand my journey around mental health, I really want to start back to my youth in Southern Indiana. You see, I was a student athlete. And in that, I focused on my physical body, making sure that I was doing everything I could to be at top physical performance. I ate well so that my nutrition was at a very high level, and I had mental fortitude. And because I was balancing both academics and athletics, I did all the fundamentals that you would think to make sure that I was excelling in both areas. And these are traits that I really took on through my adult life, into my career, into my marriage, and even as a father. And I think over the last few years, if you would have asked me, what is your stance on mental health? I probably would have answered with some form of a cliche of, if it's not broke, don't fix it. See, to me, showing signs of weakness around mental health was not acceptable, because that was a weakness in those three core areas that I subscribed to in my youth. So let's fast forward in my life to the pandemic. Early on, I'm going to admit, I was scared, and I think most people were, because we didn't know what that was going to be. And in my career, I was working with some pretty troubling matters. People were dealing with financial issues that was causing a great deal of stress, and I was stressed with them. And so my wife came to me early on and she goes, Seth, I'm worried about you. I see you're struggling. I see what you're dealing with, and I know that you are worried. What are you doing about your mental well-being? So let me frame that a little bit. My wife, before moving to Michigan, she was a mental health nurse in the behavioral health field. And so to her, her mental well-being, her preparation every day to make sure that she was ready to tackle those days' events is second nature. And this is going to sound silly, but to me, she was in the medical field. She was in the mental health field. Those are things that she should have done. I'm in a different field. So I didn't think that those practices should apply to me. So we're in the pandemic, and I kind of had one of those moments of awakening. Like, I'm not okay. This is too much for me to handle on my own. We had just moved to Michigan. I had a family to take care of, and then we had all of these events going on. And so I decided to raise my hand and ask for help. So with the help of my wife, we first started with the benefits package that I have with my company. See, I work for a very large company, and we have a very great breadth of products in our benefits package. But we also have care coordinators that you can reach out to, and they can have a confidential conversation with you, and you can work through your entire benefits and see what can help you the most. And so I uncovered that my company puts a great deal of emphasis on the mental health. And so I can see a professional therapist once a month, and it's no out-of-pocket cost to me. It's part of the plan. So since those early days, I see a therapist one time a month, and we work on that kind of cycle of stress that we're all experiencing right now. It can be a day, a week, a month. We all know there's those happy times followed by those downward curves. And we work on, how do I prepare myself to grab a hold of those good times, but then also to kind of work through those troughs, if you will, so that way they're not as affected to me. And I have to say the results have been amazing. So of the full message, I would say it's okay to not be okay. It's okay to raise your hand and seek help, because there are professionals out there within your benefits package, within the community, who their passion is to help you. And I think we all need to ditch the stigma and get in line, raise our hand when we need to, because there is help to be had. Thank you.